Breast tissue is basically of two types. There is the glandular part and there is a stroma. So the glandular part is the glands actually, which is the milk producing glands. And in the gland, there are ducts. So basically the ducts, they carry the milk from the gland and to the outside of the breast. So the most common area where the cancer develops is actually the duct. So it is the ductal carcinoma, which is the most common types. And the stroma is the part which actually is a supporting tissue of the breast. So most of the cancer actually develops from the glandular part and the ductal part of the breast. As per the WHO classification, there are a lot of microscopic and histopathological types. But the most common type is the infiltrating ductal carcinoma, which I just said. It arises from the duct of the glands. The other second common type is the invasive lobular carcinoma, which arises from the lobules. And then there are other types of, the less common types, like, there can be sometimes a sarcoma, which may arise in the breast, or there can be a phylloid tumor, which can arise from the breast. But the proper systematic classification is, as per WHO, the most common is infiltrating ductal carcinoma. Due to the exposure, or we can say overexposure of estrogen. So as we know, estrogen is a hormone which is more common and it is present in more concentration in females. So what happens is the breast tissue is very sensitive to this hormone, which is estrogen. So when there is a prolonged exposure of the breast tissue to estrogen, that is when some of the cell, they undergo perhaps a mutation, which is why the cancer arises. The other common reasons are sometimes it can be familial. So if a person has a very strong family history, especially if in the first degree relatives like mother, father, first cousin, grandparents, then this person also has a higher chance of developing breast cancer. And of course, there are some other factors which are the modifiable lifestyle risk factors, like being overweight, being obese, having unhealthy food and lifestyle patterns, like having a more sedentary life, lack of exercise routine in your daily routine. So all these in the long term can give rise to breast cancer as we age. The most common symptom of breast cancer is a lump. It can be a swelling, perhaps either in the breast area, anywhere in the breast area, in any of the quadrants, or sometimes there can be just a lump or a swelling which is felt in the armpit, or commonly like in the medical terms you call it axilla. So these are the most common symptoms and signs. Other than that, sometimes there is a change in the overlying skin of the breast. Sometimes, the skin might become reddish, or it can look as if, there is some sort of inflammation. The skin can become thickened, and sometimes there is a pitted appearance, like how it happens when you see the peel of an orange. So sometimes there can be the nipple retraction. The nipple can become asymmetric in one of the breast. And of course, discharge from the nipple is also a red flag, and especially if the discharge is blood stained, or if it is frank blood also. So these are the warning signs that this could be breast cancer. A strong positive family history of breast cancer or ovarian cancer puts an individual to a higher risk of developing breast cancer, especially if there is a person of your primary degree relatives. So mother, father, first cousin, aunt, uncle, grandfather, grandmother. So these people, so that is a familial risk. The other, of course, it's one of the most common cancers in the urban cities because of the lifestyle that we lead these days. There is, a lot of junk food in the diet. There is no exercise. Smoking is another reason, and alcohol, which does contribute to development of breast cancer. Also, one of the reasons is undergoing some kind of hormonal treatment. It can be maybe, hormone replacement therapies, or sometimes even women who undergo many cycles of IVF in cases of infertility. So what happens is the person gets pumped with a lot of estrogens and a lot of hormones, which can also cause breast cancer. So these are the most common things attributing to breast cancer. As we know, cancer as such is a disease of the elderly. So as an individual ages, the chances of developing cancer increases. And therefore, the most common age of diagnosis of breast cancer is also after 50, 55. So as the lady ages or as the individual ages, the chances are that, the breast cancer can develop. The other type is, of course, if somebody has a very strong family history, then in those cases the breast cancer can develop earlier than the commoner age. So then in that case the lady may develop a breast cancer at age of sometimes 40 or even 30, late 20s also, a few cases here and there I have seen. A mammogram is just like an X-ray, which is to see the soft tissue, because the breast is obviously a soft tissue and there's a lot of fat in the breast. So it is a specialized kind of X-ray wherein the breast is seen in lateral, in the sense the side views, and the craniocaudal, that is the head to bottom view. And there are certain views which actually help in visualizing if at all there is any doubtful area in the breast. The age for screening mammogram is 40 years. So once a lady turns 40, she should go for annual screening mammograms every year. And if it is a negative or if it is normal for 3 consecutive years, then she can go for once in 3 years. The treatment options for breast cancer is actually, it is a trimodal approach, or you can call it a multimodal approach. In the sense, trimodal because it consists of a surgery, a chemotherapy and a radiation. So all the 3 have to be sequenced in a proper manner to give the most optimum benefit to a patient. For example, if it is a very early disease, then it is advisable that the lady goes for a surgery. Then the surgery is followed by chemotherapy, which is normally 6 to 8 cycles. And then the chemotherapy is followed by radiotherapy. So that completes the whole treatment. If it is sometimes, a very locally advanced disease, which can happen. So in that cases, these days, the norm is that the patient is given upfront chemotherapy. So what does the chemotherapy do upfront? Whatever disease is there, it shrinks it down. So therefore the surgery is easier, and therefore less of the breast tissue and less of the, it is basically less extensive surgery. So it is chemotherapy and then sandwiched by surgery. And then we follow it with, if any, leftover chemotherapy, or directly then radiotherapy. One is the modifiable risk factor and the other is the non-modifiable risk factor. Modifiable means it is in our hands and we can, perhaps we have some control and we can prevent. So in that, what all comes in that, it will be the dietary pattern, what kind of lifestyle are we living? Like, is it a very stationary, a sedentary one, or are we very physically active? What is, what habits do we have? Like is a lady or a gentleman a chronic alcoholic and a chronic smoker? Because then the chances go high. Whereas social drinking and all that may not lead to, as higher risk as somebody who would be drinking every day and smoking every day. So these are the modifiable risk factor. The non-modifiable ones are which are not in our hands. So for that, the most classic is obviously the family history. Basically, to prevent breast cancer, you have to live a healthy lifestyle. You should not have habits like smoking and drinking. You should do exercise every day, have lots of greens and lots of fruits in your diet. Avoid red meat and processed meat, because all these cause cancers and different types of cancers. Self-breast examination is a very, very important way for screening and for detecting early breast cancers. So basically, in self-breast examination, the lady herself examines her own breast every month. And it is preferably not to be done before the menses. It is supposed to be done after the menses. A lady is supposed to examine the left breast with the right hand and the right breast with the left hand. And ideally, it should be done in three positions: one in the lying down position, one in the sitting position, and one in the standing position. And in all the three positions, the lady is supposed to palpate the whole breast with basically the flat surface of the hand. So this is a flat surface with this all over the breast, either in a circular manner throughout in a systematic way, or in a longitudinal, means in straight lines like this, vertical lines, or in horizontal lines, any of them. And this should be done every month because this really is helpful in detecting very early lesions as well.